Good afternoon, guys, and welcome to the podcast. I've got a fantastic guest for you today, Nishi Bhopal, coming out of San Francisco, California. And she is board certified. She is Harvard trained, and she's going to talk to us all about 5 things that doctors need to know about sleep. She's also got a course, and her specialty is psychiatry. And I'm really happy to have her on. So, Nishi, welcome.
Oh, thank you so much for having me.
Yeah, so briefly talk about your journey and we'll dive right into the conversation.
Great. Yeah. Thanks again for having me on. And I'm really excited to talk about sleep. It's, of course, one of my favorite topics. And the reason for that is personal and professional. So maybe I can tell you a bit about my personal journey, how I got into sleep, and then how I'm practicing it now. So I never knew that sleep medicine was a specialty when I went to medical school. It wasn't even on my radar. I thought I was going to be a pediatrician when I went into med school. But I ended up, like many of us, doing our rotations and then figuring out what specialties you were drawn to. And so for me, I ended up matching into internal medicine. And then I realized during my intern year that actually should have probably gone into psychiatry from the start, because I found myself talking to my patients about what was going on in their lives and how they were feeling, and really wanting to look at that sort of the whole picture, the psychological and the medical. So I ended up switching into psychiatry. And then in my psychiatry residency, one of my seniors was actually going into sleep as a fellowship. She was actually one of my internal medicine seniors, but she was going to sleep. And I was like, oh, I didn't even know that was, I didn't know that was a specialty. So that kind of piqued my interest. And I also had a personal interest because I was one of these people who had always struggled with being sleepier than my peers. Friday night would roll around and everyone wanted to go out. And I'm like, I just want to go to sleep. I'm so sleepy and tired. And I never could get a handle on it. And then I started to see my patients experiencing sleep issues, especially in psychiatry. Like the majority of our patients in psychiatry have some kind of sleep issue, whether it's insomnia or hypersomnia. So that really got me interested in learning more. And I started doing rotations and did a sleep fellowship. And here we are today. So I'm practicing a little bit of both sleep medicine and psychiatry.
Yeah, it's very interesting because there was a revolutionary book by Ariana Huffington about the sleep revolution. And it's so fascinating because I've been delving into this area of just biohacking and diet and fitness, exercise, sleep. And the more I delve into it, it's like the current healthcare system is just not sufficient, and there's just so much more things going on outside of it, and there's something that's more effective. I know you had a thesis talking about 5 things that doctors need to know about sleep, so uh, get carried on, and whatever questions we know, I'm happy to facilitate.
Excellent. Yeah. And just to highlight what you were saying, there's a lot of focus nowadays on sleep. It's one of the biggest industries that's growing in terms of medical, like the sleep industry is booming. We've got people like Ariana Huffington, Matt Walker. There's all these podcasts on sleep. Andrew Huberman's talking about sleep all the time. But back 10 years ago, when I was doing my fellowship, it was not a thing that people were talking about. I think culture has really changed where people are more attuned to it. But back then, when I was starting out in my fellowship, people still had this attitude of, oh, I'll sleep when I'm dead. That's not important. And even one of my attending physicians, when he found out I was going into sleep fellowship, was like, why would you do that? We want to help our patients be more awake, not put them to sleep. And I thought, isn't the connection obvious that if we help people sleep, they'll be more vibrant, awake, and alert during the day? This is why I'm also really passionate about teaching doctors about sleep medicine, because most of us only get an hour or 2 of sleep education and training. So I'll start with number 1 without further ado. The
Yeah.
5 things doctors need to know. So the first thing is that insomnia isn't always insomnia. We'll have patients coming to us, or even yourself, like if whoever's listening, if you're struggling with insomnia, that doesn't mean that it actually is insomnia. It could be something under the surface, which we can look at. So just don't take that at face value.
Hmm. Yeah. And so what's interesting is because I remember just the days through the residency, and just like you go to this like on call, and it's like the room is like cold, and it's like very uninviting, and and then the nurses are just calling you it's so unpredictable, and it's just remember it's just such a miserable experience. And so one thing that's what's really interesting is because I travel a lot and speak a lot, and this idea of sleep hygiene, talk about like just how you can get a really good, like deep. And the more I delve into it, it's like a routine and it's a process. And it's actually, if you can do it well, it's actually, you can perform at higher levels.
Definitely, like sleep is a skill that you can learn, and it's all about setting up the right conditions. And Yeah, I remember the call rooms being so cold, I would always grab extra blankets the nights that I was on call because I knew I would need them because it was so cold, like you said. So there's certain things you can do to set yourself up for really good night's sleep. So sleep hygiene. So sleep hygiene is essentially like dental hygiene, right? So it's a way to keep dental hygiene keeps your teeth healthy, but if you have a dental problem, dental hygiene is not enough to treat that problem. Sleep hygiene is like this. So it's a good way to set yourself up for good sleep. But if you're struggling with ongoing problems, then you might need to look a little bit deeper. And so I can share more about that in a bit. But
Mm.
essentially, some of the important things are a cool room, right? So, like, we don't want a freezing cold call room, but a room that's a little bit cooler is typically they say 67, 68 degrees Fahrenheit or about 18 degrees Celsius. I'm Canadian, so I think in Celsius, it's about 18 degrees Celsius is what's recommended. But of course, that's going to be dependent on your personal comfort because our core body temperature has to drop by 1 to 2 degrees Fahrenheit for sleep onset and for sleep maintenance. Creating a cooler ambient temperature is important. Of course, light and dark is really crucial when it comes to sleep optimization. So,
Yes.
minimizing light exposure. And I'm really a fiend when it comes to keeping my house dark in the evening. My family always laughs at me because they're like, "You're sitting in the dark." I'm like, "Yes," because it's good for my circadian rhythm. So, keeping the lights really dim and dark after about 7 p.m., setting yourself up for good sleep and keeping light to a minimum across your sleep zone. And then on the opposite end, getting really bright light in the morning. And then I also think about meal times and activities. Keeping regular meal times, it keeps your circadian clock running on time and minimizing heavy meals about 3 hours before you go to bed. And then some people, if they tend to have a bit of hypoglycemia at night, that might wake them up, then a high fiber snack about an hour before bed can be helpful. And then lastly, exercise, of course, right? So if you're sedentary during the day, it's going to decrease your sleep drive. Increasing your activity levels, it could be with exercise or just being active, up and about, going for walks and things like this. All of these things are helpful.
Mm. Yeah. And another follow-up question is just some of the sleeping tools that talk about technology and when is the best time. I found like if I just my phone is like constantly buzzing and ringing. So if I just like set boundaries, like where I just put in another room, what are the best times to just get rid of technology and talk about this light? And we'll get into some of this kind of the sleep, like night shades and all of that.
Yeah, great. I love that question. So, a couple of tips here. One is turn off all your notifications on your phone, like even during the day. I have all of my notifications turned off. I just don't like them. They're really disruptive. They put your nervous system into a sympathetic state, right? And so that's not good for sleep. So, turn off notifications. I like this strategy called the bookend strategy. So, what that means is an hour after you wake up and an hour before you go to bed, no screens. So, keep your phone away. I love your idea of keeping your phone in the other room or just turn it all off. You can actually turn your phone off, use an old-fashioned alarm clock. You can use the night shift feature to filter out the light, put the screen brightness to a minimum. And I'd also encourage people to be really mindful of the content that they're consuming because it's not just about the light from the screen that can be disruptive.
Mm.
And actually, the studies are showing that blue light from the screens isn't necessarily as disruptive as we thought it to be. So Matt Walker actually talks about this on his podcast as well. He had a researcher on named Michael Gradisar who's done a lot of work in this area. And they found that blue light exposure, it might delay sleep by 6 to 9 minutes. So we're
Mhm.
not talking hours, right? So the other thing to consider is the content that's being consumed. So if you're on your phone scrolling TikTok, or I see a lot of executives in my practice as patients. And so like a lot of people are up at night doing work. They're catching up on emails. They're putting together a deck or whatever, right? They're doing this kind of stuff.
Yeah.
And that's activating to the mind, right? So doing that kind of stuff versus maybe watching something on Netflix, it's going to have a different impact. So I do
Yes.
encourage people to take note of what are you actually doing on those screens and how is it impacting you?
Yeah. Another follow-up question is what are the best times? Because like, for example, like me, when I was my younger age, I could stay up till 2 a.m. and I could wake up and just, it was more flexible. But now in my later years, I feel like when sun sets, I'm like, what, that's like the best time to go to sleep. And then I found like waking up before, like in the hours between 1 to 5 a.m. is like the best. Just what are the best times to sleep and wake up?
Yeah, it really depends on the person's chronobiology. So we
Mm.
all have a different chronobiology. Some of us are morning larks, some of us are night owls, some of us are somewhere in between. So it's really dependent on that. And what you mentioned is often when we're younger, we're more on the night owl side, and that's pretty common. And then as we get older, your sleep schedule or your chronobiology might shift where you become more of a morning person. This is how I assess it with patients is I'll ask them, if you didn't have work, if you were on vacation, you didn't have any other obligations, what time would you naturally go to sleep and wake up? And that's just a really simple way to gauge what your natural sleep schedule should be. So for some people, it might be going to bed at 9 and getting up at 5. For others, it might be 1 a.m. to 9 a.m. So it really depends. If you're able to figure out your chronobiology and then set your work schedule around that, like that's the dream, right? If that's possible. That's why I went into private practice, because I can set my own hours and I can work around my sleep schedule. I'm not a morning person. I actually know a therapist. She's a night owl and her practice is called night owl psychotherapy. So she was able to find something that works for her. And so I encourage my patients to do that too. If you have the privilege to be able to do it, right? Not everyone can do that.
Yeah.
But so to answer your question, the optimal time, it really depends on the person.
Mm-hmm. And what's the best time because you mentioned 8 hours, but I've experimented with it where I could sleep for, I think baseline is 6 hours. And then I just take like brief naps during the day versus 8 hours or 10 hours straight. What's the best like combo?
Yeah. So the thinking is that most adults need between 7 to 9 hours of sleep every night. And you probably heard this before. Now, about 1% to 2% of people might be on that earlier side where they only need 6 hours, but it really depends on the individual. For someone who needs 8 hours, but let's say they're only getting 7, it might not seem like a big deal, right? Oh, I'm getting 7 hours of sleep a night. Oh, I feel a little bit better with 8. But that's an hour of sleep deprivation every night, and that's cumulative. So it can really start to have an impact. So one way to look at this is that if you need an alarm to wake up in the morning, you're probably not getting enough sleep. And so there's this 10 by 10 method that I like, where if you think that you're sleep deprived and you want to like just see if you can sleep more, what you can do is actually for 10 days, give yourself a 10-hour sleep opportunity. So 10 hours in bed, and then see how much sleep you're getting. Yeah. Now, one caveat here is that if you're struggling with insomnia, don't do that, because that's the opposite of what we recommend to people with insomnia. Yeah. But what I'm getting at here is the majority of people are sleep deprived. So it's really important to figure out what your individual sleep needs are.
Mm-hmm. Yeah. Talk about this area of just, for example, high performers or just people on the road constantly, or even like residents listening to this podcast, if they have to take call and how they can optimize their sleep, or even people suffering from insomnia, what are things that they can do to just optimize sleep in this area of like scheduling, routines, and all of that?
Yeah. Okay. So there's 3 different, I think, populations you just mentioned there. So the first one is the high performers. And what's really interesting about this population is that if you look at athletes, so for example, like you look at LeBron James, so they really prioritize sleep. And so he'll prioritize getting, I think I read somewhere 9 or 10 hours of sleep every night, and maybe even more during periods of high intensity training, right? So high performers need a lot of sleep, especially if they're athletes and they're physically exerting themselves. But the same goes for mental performers. So if you have a job that requires a lot of cognitive power, then you need to make sure you're prioritizing your sleep. And I'm actually just reading the book 10x is easier than 2x. And in one of the sections, they actually talk about making sleep a priority in order to optimize your productivity. Yeah. So that's one area. So that's really about maintaining a consistency with getting enough sleep. So I think about quantity, right? So getting the right quantity of sleep, quality of sleep. So we talked about sleep hygiene, setting yourself up for that. Also making sure there isn't something under the surface that could be disrupting sleep, like sleep apnea or some other sleep disorder. And then regularity of sleep. So maintaining as consistent a sleep schedule as possible with a focus on a consistent wake time. So that was population number 1, right? The performers. The second one you mentioned was residents on call or anyone who's doing shift work. That's a little bit different. There are some resources for shift work that I like. One is called Time Shifter. It's the Time Shifter app. And it's also for people who travel. So if you are traveling across time zones, it's very helpful. And it just gives you a schedule of when to get light exposure, when to eat, so that you can optimize your sleep according to your schedule at that time. But again, the biggest things are going to be making sure you're getting enough sleep, especially if you're doing shift work, and then getting light and dark exposure at the right times.
Mhm.
And then the third category you mentioned was people with insomnia.
Mhm.
So it's a little bit different for people with insomnia, because often the challenge with people struggling with insomnia is they spend too much time in bed.
Mhm.
So they're training their brain to be awake in the bed, right? So they're spending more time awake, tossing and turning, feeling frustrated. That creates almost like a Pavlovian response, a
Mhm.
conditioned response, where now they're associating the bed with being awake and frustrated. So for people with insomnia, we actually recommend spending less time in bed to break that association and to work on other strategies like cognitive reframing around their thoughts with regard to sleep, and other strategies to increase their sleep drive.
Uh-huh. Interesting. Yeah, I was just these. And another question I have for you is, where does the Eastern practices like yoga, meditation, and how can clients or people listening to this incorporate that in to enhance their sleep or their well-being and wellness?
Yeah, beautiful question. And I also am a practitioner of yoga myself and have found it to be really transformative, and actually discovered it during residency. And it helped me so much with burnout and anxiety during residency. So these are wonderful tools for anyone who's either struggling with stress, burnout, insomnia, or if you're just looking to optimize, right? Because the way that they work is they help to regulate the nervous system, activate the parasympathetic nervous system, and also create a little bit of detachment so that you have more resilience with whatever's going on around you, right? You're not caught up in that whirlwind. It's like you're watching the whirlwind happen, but you're
Yeah.
not in it. So there's actually research showing that these practices can be very effective for people with insomnia. Also for stress, we use in psychiatry, we recommend these practices for people with stress, anxiety, depression. They're very effective.
Mm.
The gold standard treatment for insomnia is cognitive behavioral therapy for insomnia, or CBTI. But
Mhm.
there are some studies looking at MBSR practices, mindfulness-based stress reduction, compared to CBTI. And they found that these protocols can be just as effective as CBTI for people with insomnia, and maybe even more effective over time, because people are now learning these tools that help them in so many other areas of life,
Mhm.
right? The short answer is that yes, these tools are very effective, with the caveat that for someone who's really struggling, and this is something I see all the time with patients, they're really struggling with sleep. Now they're trying to do their headspace meditation at bedtime or some other kind of guided meditation practice. And they're like, this isn't working. Now they're frustrated. And so they're doing those practices with the hope, with an expectation there's going to be a certain outcome.
Uh-huh.
And these practices are actually not meant to give you a certain outcome, right? Like part of it is letting go of that attachment to the outcome.
Mhm.
So that's just one caveat, is that you don't want to be doing these relaxation practices or meditation practices with the expectation that it's going to put you to sleep. And in fact, there was a recent study in the American Journal of Psychiatry showing that people just doing these relaxation practices actually could potentially have worse outcomes. It could worsen symptoms of insomnia because of that expectation that people start to develop.
Whoa, interesting. Yeah, it's quite interesting, just this area and just this. It's great that you're coming onto the podcast and shedding light and awareness. And because this area is like sleep is almost just, it's if you can maximize it and if you can optimize it, you can actually enhance your performance in your career and your profession. You mentioned athletes or even doctors. What about when you say insomnia? What brought me to my mind is these very high stress fields like our surgery or just very just dysregulating to the nervous system. And how do you calm yourself down when you're day in and day out exposed to that type of stimuli and stress and your nervous system is ramped up? How do you mitigate the damage from these types of stimuli? How do you get your nervous system back in order?
Yeah, excellent question. And I think that there's a few aspects to that. I think one is introducing some of those Eastern practices
Yeah.
to give yourself a bit of that separation. But I think it's also really important that as doctors, we have a life outside of medicine,
Mhm.
because so many of us can get caught up in our day-to-day work, and our identity gets tangled up in our careers, right? And so it becomes almost like a part of you. And yes, indeed, medicine is a calling for many people. At the same time, you don't want it to be the only thing in your life. So I think making sure you have a well-rounded life. And again, this is something that we talk to our patients about in my practice. to make sure that they're feeling fulfilled in other ways. We have a high rate of mental health issues in medicine with doctors. Physician burnout is a huge problem. Physician suicide is a huge problem. So I also really encourage people to talk to a therapist or talk to a psychiatrist and get some help. And I really encourage people to do that and to seek that out if they do find that it's hard to create that little bit of separation, or if they're feeling overwhelmed, help is available.
Yeah. How can people find out more about you? And tell me, briefly, I know you have a course as well, and talk about that and what it entails, and then how can people contact you and follow you, reach out to you, check out your website, check out your work?
Oh, thank you so much. You can follow me on YouTube at Intra Balance. It's INTRA Balance. So I've got lots of videos for doctors to learn more about sleep. I have an online course for doctors. It's called the Clinical Sleep Kit. It's a membership program. So you can come in and learn about sleep and get supervision from other faculty members and connect with other physicians and health practitioners.
Mhm.
And then my private practice is called Pacific Integrative Psychiatry. You can go to pacificintegrativepsych.com, and we see patients by telehealth all across California.
Yeah, I love that. That's the beauty of psychiatry is like you can do telehealth and just so many new ways. And I have a good colleague, Dr. Brooke Choulet. She's in Arizona, and she's actually specializing in elite mental athlete performance, which is really interesting. So very fascinating field, fascinating work, and keep up the great work.
Thank you so much.